both her ears are not functioning. Both her ears are dead. She's not able to hear anything. They literally cry in our OPD room and they ask this one more question. Doctor, will my daughter speak ever again? Will she be able to hear voices at any time? Parents have to take a leave from their work. They have to travel very long distance. And India traffic is something which is very horrible. So that's something which is very, very devastating for many parents.
It turns the family's smartphone into that equipment. So no longer do they need to come all the way in. Instead of their cochlear implant being a medical device, it makes it into a cool high-tech gadget.
I was imagining Cyborg in Justice League, or how this Iron Man, he answers everything.
With AB, we work off 120 channels, and what that means is we can get up to 466 distinct pitches. Because we've got an implant in the head already, can we measure the brain responses to sound to see how that child or an adult is reacting to the sound? It's in the early phases, but we can actually get objective scientific information to see, is the brain adapting to the sound?
I'm going to remove this wait and see option from the equation at all. It is providing all the mothers a mental peace of mind, stating that yes, my child is hearing. Hello, namaste. I'm Dr. Shree Rao, pediatric ENT and cochlear implant surgeon. As a hearing restoration surgeon, I've had the privilege of performing hundreds of cochlear implant surgeries. But most importantly, I've witnessed firsthand the transformative power of these cochlear implants on the life of kids. Through this podcast, I'm going to cover what to look for when you're choosing a cochlear implant system, what are the advantages, what are the advanced technologies that are available in order to ensure that your child hears perfectly and speaks with clarity. And to address this, we have Mrs. Jade Dornan, clinical specialist, education and training manager for the entire Asia Pacific countries from Advanced Bionics, based in Greater Sydney, Australia. Jade is a true intersection between human biology and high-end engineering. Jade, it's wonderful to have you with us.
I'm really excited to be here with you today. The work that you're doing to elevate clinical standards within India is truly impressive, and I'm excited to talk about some of the things that we've been doing along with you to support you on that journey.
So Jade, let's talk about the clinical journey. I know in Australia, the healthcare system is highly structured, but it's not the same in our country, India. Parents, they're a very young couple. They get their kids around 2.5 years, 3 years old. They look very devastated. They say, Doctor, my child was not responding to sounds at all. So we got her hearing evaluation done, and it turned out to be both her ears are not functioning. Both her ears are dead. She's not able to hear anything. They literally cry in our OPD room and they ask this one more question. Doctor, will my daughter speak ever again? Will she be able to hear voices at any time? Will she be able to go to normal school? And now, Jade, from your point of view as a clinical specialist, how does the rehab system differ in our country when compared to other developed nations like yours? And is there any advanced technology in such a way that to help these patients get that mental peace of mind? Because we don't have newborn hearing screening and early intervention. It's just a developing nation.
It's a really, really good point. We're really lucky in Australia to have a very well-developed newborn hearing screening process. That means that the little bubs are going to be found to have that hearing loss so early that we can start with the early intervention. They're implanted early, and essentially every week they're going to have appointments with a specialist on their hearing therapy to learn to hear sounds and learn to speak. We're really, really fortunate in Australia to have that. And it is a little bit different here in India.
Yes.
We know that there isn't always the access or the ability to have so many regular appointments with a trained therapist. And because of that, the family takes such an integral role in the hearing rehabilitation.
True.
So what we see is that the mothers and the grandparents, they are the ones who almost become the therapist. So what we invest in our tools and our resources is ways to help the families become that therapist, to do these listening activities within the home to support that child to get to where they need to be, to meet their hearing milestones, and then to hear like their other children at school.
Wow, that's truly amazing. What you said is perfectly right. In our country, we have the opportunity, we are blessed in such a way that grandparents also become therapists. We have that extreme support. And is there any technology you could help these grandparents to understand very easily and do the weightlifting from your side?
100%. I think it's really important that there's this marriage of having the great technology to remove the barrier that's there. They can hear the sound well, and then couple that with the therapy to be able to build those skills. And of course, Advanced Bionics is a technology company. We have lots of technologies that are designed to bring access to the sound to be able to build those hearing skills. There's so many that we could talk about. I think if we start with just some of the fundamentals, we have a technology called the 𝐃𝐫. So this is a microphone that sits at the entrance of the ear canal, and it's a really simple thing. We kind of take it for granted that a microphone needs to be precise technology. It needs to be a good quality microphone, but also the placement of that microphone is really important. So with the 𝐃𝐫 sitting at the entrance of the ear canal, it's capturing sound the way that the normal ear captures sound, and it's passing that through to the child to hear. There's a few other technologies as well that kind of come together to give that access to sound. So another of the technologies that we have that works together with the 𝐃𝐫 is the input dynamic range. With Advanced Bionics, we have the widest input dynamic range. What that means is that our system can capture the really soft sounds, so the whispers, the different sounds in the house, up to the louder sounds. And that's really important because if we're thinking about incidental learning, so child's just learning about the environment, the different sounds, as well as speech, we need to hear those really soft sounds and the loud sounds. So having the widest input dynamic range in cochlear implants is an important facet, and it all works together.
So you mean the 𝐃𝐫, which is patented from Advanced Bionics, and also the wider input dynamic range. I think that's an industry level. You are the highest among the industry level. Perfect.
That's right.
And really thank you for doing the heavy lifting for developing nations like our country. And because you mentioned about the home learning, the home environment where even grandparents can help them. Let me ask you one commonly asked question, Jade. They ask me, doctor, because the technology is so good that why can't we go with one implant on one ear? Why should we go for both the ears? Is one implant really enough, Jade?
It's a natural question. We get this question a lot. When I was in clinic, I would hear this a lot too. The reality is, as you know, Dr. Rao, we are born with two ears and our brain is designed to listen with two ears. When we are limited to input of sound with just one ear, it's much harder for our brain to make sense of the sound and to learn to hear the speech and everything in our environment. So two ears really does make a big difference. The way that Advanced Bionics approaches this is that we always look at the two ears working together. So it could be two cochlear implants, it could be a cochlear implant and a hearing aid. Everything we do is looking at a person as a whole. That child has two ears. Let's optimize them and get them to hear together.
So you mean to say it's not just about the volume, it's about the clarity against the chaos. So Jade, do you have any extra advanced technology in such a way that, because in India, when most of the kids that I operate are pediatric kids, and our schools are designed in such a way that we have fans. Rooms are very noisy. And in fact, we have almost 30 to 40 kids in each classroom. So I understand that you have the highest input dynamic range of sound. But is there any advanced technology more than that, other than creating the volume in such a way that there is some noise cancelling, something like that?
Most definitely. So again, because Advanced Bionics is an innovative company, we've come up with lots of different technologies. They work together, but I'll try and pull a couple apart here to kind of explain how they work to help a child in the classroom. One technology that we have is called Clear Voice. This is one that we are so proud of because it's the only sound coding strategy that's gotten a superiority rating from the FDA.
It's clear voice.
Clear voice. So that's a pretty big deal. We're very proud of it. What it does, what it means for families is that it's always listening to the sounds in the room, and it's going to automatically adapt for that child. So they don't have to do anything. The parents don't have to worry. The teachers don't have to worry. But what it's going to do is as soon as the sound is raising in that classroom, as you said, the ceiling fan, the other kids, the class next door, the traffic outside, it's hearing that, and it's going to reduce that noise to be able to highlight the speech more. And that's so important for the child, whether they're hearing with one ear or two ears. We need these extra technologies to be able to give them more speech and less noise so they can really focus on what's important, which is the learning. And what we really see with technologies like this is its impact on the brain. When we are straining to listening in noise, even for people with normal hearing, we have to focus harder. You can see it in our eyes, we are straining. If we can relax all of that for the child's brain, it gives them more capacity to focus on the learning in front of them, to focus on their reading, to focus on their mathematics. It just allows them to be a child like everyone else in the classroom. So this is, the amazing technology, but the impact is that the kid can just be like every other child. If I can tell you a little story about Clear Voice, when we first released this, we were doing some clinical testing with it. So this is many, many years ago now. And we came up with something that we called the Clear Voice Eyes. And this is because the way the technology works, there's about a 3-second delay before it turns on. So it's listening to the room, it's seeing, okay, there's noise. And then 3 seconds later, it switches on. So when you're looking at someone with a hearing loss, listening with our technology, they're focused really hard. They're trying to hear the speech away from the noise. Then the technology comes in and you see this relief in their face. Their eyes relax, their face relax, often their body language relax as well. And this is like the physical version of the technology turning on. We can actually see it playing a role. And this is why we've had this technology for years, but it really sticks with me because it's a physical change that we can see in the child or in the adult when we're turning this technology on. So we know that it's impactful. We know it's making a difference. It's picking out the speech more, but it's enabling them to relax, not be so fatigued at the end of the day, get through that whole school day. And I know the school days in India are long days as well.
Yes.
We need them to listen for a long time. So these features that are not just improving the speech, but also just relaxing the brain, these are really important for a child to excel in the classroom.
Yeah. So you mean to say that rather than struggling to understand speech, there will be an effortless hearing. I can say effortless listening without any effort. That's fantastic. If I could add to this as a surgeon myself, if you look into the physics of sound, that's what we read earlier. I always tell my patients this: a single cochlear implant is definitely a boon for kids, but this works in silence. In the noisy environments, a single cochlear implant is not enough. Brain needs to perform three-dimensional auditory scene analysis. It requires three-dimensional auditory input. It could be because of the head shadow effect. It could be because of the binaural summation. It could be because of the binaural squelch phenomenon, what you call it as suppression phenomenon. Finally, I would like to convey to the parents this way that, and research very strongly supports this, Jade, even you know about this. In hearing, 1 + 1 is not equal to 2. 1 + 1 is greater than 2. And that's the point they need to note. Finally, it should be an effortless listening rather than struggling to hear and finally exhausting at the midday itself. So Jade, because we are in this flow of where binaural stimulation is important, bilateral implantation is important, let me ask you a complex situation where people do come and meet me. Some kids, they have some amount of residual hearing on one ear. Residual in the sense where somewhere around 70 decibels, moderate to severe hearing loss. And on the other ear, they may have profound loss. That's somewhere around 90 decibels of hearing loss. So in these situations, what we usually advise is to go ahead with the bimodal hearing, where I'm going to do implant on the profound hearing loss and perform and ask them to use a hearing aid on the other ear, which has moderate to severe hearing loss. Now, the common question that parents ask me is, Jade, doctor, because we are using two devices on both the ears, will the brain be able to understand this? How can we answer this?
It's a pretty common question again, and it's a bit of a tricky one. Traditionally, the way that a cochlear implant and a hearing aid work is really different. So essentially, we are putting two different sounds into the one brain and expecting that brain to make sense of it. That's a challenging task. We know our brains are amazing. We know that kids' brains in particular are really plastic and they're able to adapt to things, but it takes more work. It makes us more tired. So if we think about this like an example of watching a movie. So say we were watching a movie screen and half of it is in black and white. And then the other half of it, we've got 4K, maybe it's even in 3D. So we've got two different kind of sounds or two different kind of visions in this example. We can watch it and we can make sense of it, but we are going to be focusing so hard to figure out what's going on that it just is draining.
True.
It's the same with our ears. If we're listening with two different radio stations, it's hard to pull them together. So that was the traditional challenge we had with bimodal, that the acoustic and the electric just weren't really coming together in the right way or an easy way for the patients. But what Advanced Bionics has done is we've come out with a linked hearing aid that actually connects with the cochlear implant.
So you mean link hearing aid? You mean to say one side with the hearing aid, they are going to get the acoustic hearing, and the other side with the cochlear implant, they are going to get the electrical hearing. But Jade, as a surgeon by myself, I know it's very difficult to sync these both together. And I know Advanced Bionics has come up with this link hearing aid. But will all the implant companies follow the same principle? Anyhow, brain requires some time to adjust this one. Is there any technology that these two work together? Why did they give this name of link for this?
Yeah, and so that's the important thing that we worked so long on, to actually bring the hearing aid and cochlear implant together and link them as one system. So with Advanced Bionics, they're not two different devices working on their own, doing different things. We have the Phonak Marvel Link hearing aid, and then we have our Marvel CI, and they actually work together as a pair. So they're not just listening to the same sounds, they're actually treating them in the same way. So what that means for that one hearing brain, because we still only have one brain, even though we have two ears, it means that the signals that are coming in, when there's noise, both devices hear their noise and they use the same kind of technology to treat it and help get rid of the noise, focus on the speech. So they're working in the same way at the same time. So that truly brings the clearest signal together. And this is all part of, again, giving less strain to our brains. So with Advanced Bionics, the way that we've implemented bimodal is different to how all the other companies are approaching it at the moment. So our NIDA Link hearing aid and our Marvel CI or Sky CI actually work together. How that really works is they've got the same brain. They use the same chip, and they use something called AutoSense OS. This is a technology that is essentially the software within them. So they're using the same software to listen to the room and make the same decisions about how much noise there is, when to turn things on and off, and when to put the right sounds through to that child. So this is completely unique in the industry. We are the first and only to have a linked system where both devices use the same chip and are able to actually share that information together. And this is the kind of thing that not only makes it easy because you don't need to change programs on both things, they work together, but it makes it easy for the brain because it's getting one more synced signal together.
True. I think this is the reason why, Jade, because kids, they cannot tell about this, but for adults and for teenagers who have been using hearing aids for pretty long time, the most common complaint is that, doctor, I'm able to hear the volume. If you increase the volume also, I'm very normally able to hear the voices, but the clarity is missing. That is what they say. And the minute I implant on one side and put a link hearing aid on the other side, within 1 month, Jade, you'll not believe, they say that, oh my God, my hearing is much better. It's so crisp. The clarity is so crisp. I would have chosen this implant earlier only. Now everything makes sense. with AutoSense OS.
I definitely remember that from clinic as well. So before we had these linked hearing aids, patients who would get bimodal, they would just say it was off sync, it wasn't working together. They would explain things like it's like two different radio stations and it just doesn't seem to make sense. But once we have this linked bimodal, it just makes them feel more comfortable, and they often say they don't feel off center anymore. They feel more in balance.
Are there any other companies also doing the same kind of thing? I think they have to buy a hearing aid separately, an implant separately. They do not have this something with their sister company.
This is correct. So only Advanced Bionics have a true linked system that the hearing aid and the cochlear implant are specifically designed to work together and actually talk to each other. So we can talk to apps. So we have one great simple app where a family could turn things up and down for both devices.
Oh.
But on top of that, the devices talk to each other, and that's how we can optimize the sound more and give the best sound input to try and get the best hearing and speech outcomes as well.
Wonderful. Amazing. So it's just like a single ecosystem.
That's right.
Fantastic. So now, Jade, let me ask you about the teenagers. This is a specific, completely different group. I remember one smart guy, he was asking me, Doctor, I study very well. I don't mind wearing this implant at all. I have very good hair, I can cover it up. My only concern is this. All my friends, they have mobiles, they have laptops. They wear this headset and they look very cool. In fact, they do gaming, they attend online classes, they do their homework on these laptops. But I always feel I'm left out with that. Is there any way that this advanced technology can fit this teenage group in such a way that they don't feel that they are wearing a medical device? It should just look cool, like a cool gadget. Is there any technology available that way?
Yes, you're right. For teenagers, fitting in with their friends is one of the most important things to them. And one of the biggest changes I've seen in cochlear implant technology in the last few years is wireless streaming.
Oh.
The way that we've implemented it with AB is universal Bluetooth connectivity. What that means is that that teenager can connect to any different type of device that has Bluetooth technology in it. So when we think about mobile phones, we're not just designing things to work with an iPhone or a few phones. We've got made for all. It will connect to Android phones as well as iPhones. So this teenager who's on the bus on the way home from school can be listening to their Spotify.
Oh.
They can be taking calls through WhatsApp. Everything else that their friends are doing, they can do it too. So it's essentially turning their cochlear implant into a high-tech earbud. So it is something cool. It is something that just helps them fit in with their peers. The other thing that we've done when we've implemented universal Bluetooth connectivity into the Marvel CI is that we've included hands-free calling. So with any other cochlear implant, if that teenager wants to take a call on that bus or at home, wherever they are, they still have to get their phone out of their bag and lift the phone up to use the microphone so the other person can hear them. The Advanced Bionics Marvel CI or the Sky CI, we're actually using the microphones on the ear. So they can keep that phone in their bag, they can keep it on the other side of the room, they can have that phone call just by answering it on the ear, chatting away with their friends, and no one even knows that they're on a phone call. So these are the really cool things that make you able to be a teen, be just like your friends, and access all of this technology that's just part of our lives now. And then the other thing that I think of is really important is you mentioned gaming consoles. There's so many hobbies that rely on sound and streaming. There's also education that relies on it. So the other thing that's really important with universal Bluetooth connectivity is connecting to other devices. So not just a phone, connecting to the laptop at school, connecting to the iPad at home, connecting to a gaming console. Anything that's got Bluetooth, they can directly connect with their cochlear implant and hear that sound just like their other friends can. Or even easier, because they don't even need to put a different set of headphones on. They've already got the technology. So instead of their cochlear implant being a medical device, it makes it into a cool high-tech gadget.
Wow. This universal Bluetooth is a total game changer, Jade. In fact, the way that you were mentioning, I was imagining that cyborg in Justice League or in Star Wars, or how this Iron Man, he answers everything. Yeah, yes, go ahead.
Yeah, it's the future, but it's here now for our cochlear implant recipients.
That's really wonderful, Jade. Now, because we are talking about these teenagers, for them, music is something which is cool. Do you have any technology in such a way that it can also capture this microtones of the music?
Yes. So another technology that AV's worked really hard on is our current steering technology. So traditionally, music is actually quite a complex sound. It's quite hard for a cochlear implant to pull apart all the important pieces of music and pass them through. What we've done with Advanced Bionics is we've created a specific technology to get more of the music information or more of the spectral information. So usually a cochlear implant would work off 12 or 22 channels. With AB, we work off 120 channels. And what that means is we can get up to 466 distinct pitches.
Wow.
And this is what's really important for music, picking out all the fine details. So to be able to really enjoy and get the emotional side of music, we need all this extra information. So that's like the subtle pitch information. We also need the difference between the big loud drums and then the soft sounds as well. So all of this comes together, and with our current steering technology, we can pull that apart to give that richness and texture back to music. And then because it's easier to listen to and more enjoyable to listen to, they can get the musical, they can get the emotional aspect of the music as well.
What's this current steering technology, Jade? Can you just explain to normal people what this is? Current steering technology?
Sure, it's something very complex that our engineers have worked on, but if I try and explain it simply, what we do is instead of just activating one electrode at a time in the cochlea, what we can do with our system, because of what's in the implant, we can actually turn two electrodes on at the same time. So what we can do with that, it's a bit fancy work, but essentially we can actually create what we call virtual channels. We can move the current around more in the cochlea. So instead of just being able to give a few different tones, so if you think about maybe like that little first keyboard you get as a kid, it's got 12 or 20 keys. You can play a few different keys. But with this, it's more like we have a grand piano. So we have more different pitches, more distinct tones that we can pass through to the patient so that they can hear that sound and hear the music in a more richer way.
Yeah, now that makes sense. If you look into the physics of sound, also, if you look into the cochlea is designed in such a way that there is that tonotopic gradient where the lower frequencies are at the apex and the higher frequencies. And definitely, if an implant is able to replicate that, that will be wonderful, because it's not about the physical number of contacts. It's not about the physical contact electrodes. It's about the number of pitches that you're going to provide. And that's what makes music grab that microtones. Now, Jade, let's just shift the gears a little bit. Getting an implant surgery is the simplest one. It hardly takes for about 45 minutes and everything is done. But the most common problem faced by many parents of these little kids is that they have to get these kids very regularly to the centers for something called mapping, programming. And to get those kids, it may look very simple. Getting those kids to the center, getting mapping, programming done, it hardly takes 20 minutes to half an hour. It may look quite simple, but if you look at it in depth, they have to visit once in every 3 months for about one entire year. And this continues throughout their lifetime. We call this as mapping sessions. For this, getting the kids to the center, parents have to take a leave from their work. They have to travel very long distance. Initially, it sounds okay, hardly 20 minutes, 30 minutes. But doing all this, traveling, leaving work, and getting their kids, booking an appointment, and making them sit there with all the wires connected is something which is very, very difficult for parents. I have seen them directly. Now, is there any way that you could help people, parents like them, so that they can shift all this, they can remove all this and directly focus on their work and make it quite simple?
Yes, thankfully, we've talked about a few different technologies, and a lot of them have been about how to improve the signal, how to help people hear more. The remote programming technology that we've brought in recently, this is probably one of my favorite technologies because it actually changes the way how we can deliver care. It actually starts to democratize cochlear implant care so that it's not just those who are close to the clinic. It's not just those who, have enough family support to get the kids in and out for all of these appointments. We can start to have a more patient-centric approach. So what we have with Advanced Bionics is called the Remote Support app. And with this app, which is for Android or iPhone, so really simple for many people to use, it essentially turns what would be usually that really big, expensive equipment that's sitting in at the hospital, it turns the family's smartphone into that equipment. So no longer do they need to come all the way in to access that equipment. And then you or the other professionals can stream in through Wi-Fi, through the cloud, talk to the patient, and essentially anything that would be done in the programming appointment, the mapping appointment in clinic can now be done through the phone. So this completely changes how we can provide care to patients. Like you said, there are so many barriers to getting into an appointment, whether it is just the struggle to get the child there, whether it is taking the time off work, losing money, sitting in the traffic, which I experienced yesterday. There's so many barriers, and it's a simple app and it can just revolutionize how we're providing that care.
Is the app easy to use? Can even grandparents, parents, everyone can use that?
Definitely. I think this is something that our engineers over the recent years have really focused on, making sure that not just that we have the best technology, but it's also really easy to use. So the interface of the app, it just has a couple of screens that you connect, you click into that you're in a waiting room, it'll say we're waiting for your professional, and then once the professional's there, it'll just open. And it essentially just looks like a voice, a FaceTime call for the recipient. They see the face of the professional, they can talk, so they can do the lip reading. It uses the speakerphone, so the family are involved as well. It's not just streaming to that child, which could be confusing for the caregivers. It's putting the sound into the room so everyone can be involved in that appointment. The family can still answer questions to the therapist, and everyone's in that appointment very much like if they were in the room, just without having to go on that long journey to get there.
Wow, that's something which is revolutionary, I can say. But Jade, because this is such a fantastic thing what engineers have discovered, so is this accessible for all the generations? For example, if I operated on a child somewhere around 5 years or 6 years ago, can they also use this technology?
Yes. So the remote support app is backwards compatible for those who have had their implants for some time.
It's backward compatible.
So we need the Marvel CI sound processor or the Sky CI sound processor to connect with the remote support app. But they could have an implant back to our C2 implant. We've had that implant for almost 25 years. They can still access this great technology. And again, this is why technologies like this excite me, because we're able to help people who have been implanted for so long. But we also know that people we're implanting now are going to have access to these amazing technologies that we haven't even thought of yet, but they're going to come in the future, and we're going to be able to bring them back into our implants. Because the way that our engineers have designed our implant, if we think of the Ultra 3D implant, our current implant, we define that as a smart implant. We define it as future ready because we know it's got the capability to deliver these future technologies that we're still working on or we haven't thought of yet. They'll come to the patients and they'll be able to give them more benefits into the future.
Wow, that's fantastic. Why did I ask this question is because, Jade, I also work with other companies where some of the parents, they were so anxious that, doctor, I got my child implanted 6 years ago, but now I'm not able to use the most recent advanced technologies that they have gotten. Now for me to access that, I need to change my implant. That's what they are mentioning. They're really stressed out with that, and that's the reason I asked. The thing that Advanced Bionics is doing is something which is a total game changer, Jade, because ours is a developing nation. For us, the amount of money that we are spending on these implants is huge, even for a middle class person or for a high-end person. So it should be in such a way that it is the technology that you are inventing or discovering should be useful for everyone who gets an implant. Once the implant is done, That's all. It should be that way. And we sincerely thank all the scientists who have done, scientists and engineers, for the specific backward compatibility, which is the USP of Advanced Bionics. I think this remote programming is a kind of boon for working people like us, right?
Yeah, the interesting thing, when we started to launch this in Australia, we were really thinking about it for something to help that geographical distance. So Australia has really big distances, just like India does. And we were thinking, oh, this is just something for people who live a long way away. But as we started to train the clinics on this, as we started to talk about it more, we also realized for ourselves that this is just as important for someone who lives in the middle of the city. For the busy professionals, they only have a half-hour lunch break, if they get a lunch break. So they might not want to take half a day off to come on in for an appointment. The busy families who are trying their hardest to give their children the best head start in life, they have lots of different activities to go to. Taking half a day off school for those kids is a big deal, as well as, like we've discussed, with the loss of income and time out. So it really is not just something about overcoming distance. It's something that just makes it easier to access care for everyone. And if I think about a story that happened when we first launched remote programming in Australia, we just had the Marvel CI, and there was this beautiful little boy who has some complex needs. He just had his Marvel CI upgrade. So he got 2 new Marvel CIs. Very excited little boy. And it was a great appointment, and the family went home. When they got home, the mother realized that the audiologist had forgot to turn on one feature, which is the flashing LED light. And that's just something that helps the mum know that the device is working, my kitty's hearing okay. But the audiologist forgot to turn that on. So in the world before remote programming, that family would have had to call the clinic the next day, because it's out of hours already, try and reschedule an appointment. Who knows when they can get that appointment? In a couple of weeks, maybe. Then on that couple of weeks day, the mum has to take more time off work. The kid has to take more time off school. That's how it would have had to work.
True.
However, because we had remote programming, the very next day at 4 o'clock, once the kid had finished school, the audiologist connected with the family through the remote support app. It took about all of 2 minutes. They turned the feature on, said hello, checked everything was doing okay, and that was it.
Oh, wow.
So the impact for that family, you can't underestimate that. As a mother yourself and myself, it takes a lot to move kids around and to do all the things that we need to do for our children. The way that technology can just simplify life is just, that's one of the things that blows me away. And I'm really passionate about what we can do to now reach more people and make it easier to access the care for cochlear implants.
That sounds great. As I said, it's really revolutionary. It completely changed the game. Jade, you were telling about the light blinking for that little boy, and they could understand that the implant is working. That's fantastic. Let me tell you what recently happened in my hospital. There was this young person. He works in a bank. He got his implant done, but he was not coming for regular therapy sessions at all. He didn't have time because he is a working individual. He got his implant done mainly because whenever people are talking to him, the clarity of sound was missing in spite of using hearing aids. Now, because he's already postlingual, he already developed his speech. He just wants to track his progress, how much this implant is benefiting him. That's his main thing. Rest everything is already postlingual, so he knows everything. Is there any way that we could help people like this rather than coming for the therapy center and attending therapies? Anything that could track their progress at their workplaces only?
Yes. So we have the AB Listen Fit app, and that was specifically developed to empower people on their hearing journey. So it gives them the tools in their pocket, in their phone, to be able to test their hearing, to be able to see, am I still hearing the soft sounds? They can do some tests in different languages to make sure that they're still hearing well. So someone like that who maybe one day they're just thinking, oh, I'm not sure if I'm hearing well today. they can do a really quick check and then they can get the feedback. You're still getting the same results. Everything's okay. Or on the other side, they can do that test and go, ooh, something's changed. I better go back into the clinic now. Now I can prioritize that. So it helps give them the insights and the tools to know how to manage their hearing themselves without having to go in every 6 months if they don't need to. If things are good, they can have the power to take charge of their hearing themselves.
Yeah, that's fantastic. Now, because he's an adult, he can just use this AB Listen Fit app. How about kids, Jade? They'll not be able to track their progress by themselves. How can kids track this?
Yeah, that's something that we're working on. So the AB Listen Fit app can be used with teenagers up to 13 years of age, and it can also be used with the family support. But the kid will need some kind of language. So what we have now is the AB Listen Fit app, but we are working on future technologies as well. So you would know that we're working on a cortical study. So we're in the research phase at the moment. And what we're trying to understand is, because we've got an implant in the head already, can we measure the brain responses to sound to see how that child or an adult is reacting to the sound? So what we can do is, and it's in the early phases, but we can actually get objective scientific information to see, is the brain adapting to the sound that's being shared? So is that kid learning to listen? So that's pretty powerful. So we're still in the research phase. We're partnering with clinics like yours to make sure we're gathering enough information to know how to implement it in our technology. But that's something that's coming in the future, because we know that every parent is going to want to know every day, is my kid hearing okay? Are they actually learning to hear? Is their brain developing? We're on track to be able to see that objectively with our corticals.
That's fantastic. Actually, thank you so much for collaborating with Dr. Rao's ENT Hospital for this fantastic research study, because this is something which has been there in my mind since quite a long time, because parents keep asking me the same question over and over again. Doctor, is my child hearing? Doctor, is my child hearing? The only answer that I give them is, let's wait and see. Your child is definitely going to hear. That's what most of the time we used to tell. Now, I'm not going to say that. I'm going to remove this wait and see option from the equation at all. This is because most of the cochlear companies, cochlear implants are designed in such a way that there is something which is blinking here and we understand that the implant is working. And then we do intraoperatively C-arm and X-ray to check whether the electrode is within the cochlea or not. And also we do neural response imaging and state that yes, implant is functioning well. Functioning of the implant is well, but is this sound reaching the brain or not? Is the child able to understand the sound or not? Is the child's brain developing or not on par with others? These are the questions that are not answered. And that is what fascinated me. Now we are at a situation where through the reverse telemetry, the implant itself will tell us, we call this as electrically evoked cortical auditory potential, ECAP values. We can assess whether the sound is reaching the brain or not. How is the brain development of a child who underwent cochlear implant surgery happening? And this is something which is amazing. It is providing all the mothers a mental peace of mind, stating that yes, my child is hearing. I can see that latency graphs which are there. He's improving day by day. And thanks to all the engineers and scientists who have designed this, and sincere thanks to Advanced Bionics for collaborating with us on this project. Hoping for the best and the best results out there.
Thank you for having me with you today. I always learn a lot every time I'm with you. This is the perfect end to my trip here in India. This has been a very exciting thing to be part of, and I'm excited to share more about this with other professionals as I go home to Australia as well.
Thank you, Jade. That was an incredible deep dive into entire cochlear implant journey. Thank you so much for taking your time and providing your valuable insights, being a clinical specialist and education and training manager for the entire Asia Pacific region, and training our parents also, our Indian parents also, to take an informed decision when choosing a cochlear implant. Now, in case if you have any questions regarding cochlear implants or hearing technology, feel free to put your questions in the comment section below. We'll try to answer as soon as we can. Namaste.